Hello everyone, my name is Haikal. So in this program, I gain two things, which is I gain a lot of knowledge and I got many new friends. So I hope this program can further continue in the next semester or the next year. That's all from me. Thank you. Bye.
Hello, and those 2 days workshop with the collaboration of San Pedro College and University of Kebangsaan, Malaysia, I gathered a lot of information which it helps me to gain more knowledge in terms of identifying different causes of medical adherence. It also added my skills in terms of comprehension, communication, and analysis since we need to interact and share our observation of the given cases. Aside from that, we also talk about cultural differences and pharmaceutical practices in the Philippines and in Malaysia. But what I am thrilled about in this collaboration is that I met and gathered a lot of new friends.
Hi, I am Kim Miguel, and one of the things I learned during the collaboration with UKM is that pharmacists should think outside of the box, which means in assessing our patient, we have to deeply understand why is our patient non-adhering to the medication he or she is prescribed to. We also have to consider their social history so that we can create a better care plan which is suitable for their situation. And with that, we can provide an optimal care as a pharmacist.
Hello, I'm Nazira from UKM. From this call, I gained new knowledge, especially during the medication review sessions, where I got to know the cultural differences between Malaysia and Philippines in many aspects. While during the pharmacokinetic session, I learned how to identify the drug-related problem and how to intervene the problem, but at the same time increase the quality of life of the patients. I also got new friends during this program. That's all from me. Thank you.
Greetings everyone, my name is Rashmi Balakrishnan. I'm from UKM. What I've learned from COIL program. In education wise, I've learned about clinical pharmacokinetics and medication reviews, such as how to calculate the dosage, how frequently we need to give medications, what are the medication adherence, and what are the potential drug problems and also pharmaceutical care issues. In general wise, I am able to get to know the Philippines cultures and social lives, which is very interesting. I wish I can work together with them in future. Thank you.
Hello, it is I, John, and I will now state what I learned in this event. And it is the idea that we should not look at things as it is or like be tunnel vision by the problem right in front of us or the perceived problem in front of us, in this case the prescription. We must always look beyond on the possibilities and what causes the problem, as sometimes it's not written in the prescription. Sometimes it can be from intangible stuff like beliefs. The patient is another human being, and as such, they have beliefs or ideas that might be alien to you or something that you don't subscribe to. So it is an important aspect that we must always approach these things holistically, so that we leave no stone unturned, and that our patients' health will improve, and that thanks to this event, it reinforced if we learned it before. It is reinforced if we learned it before, and it is learned if we didn't, and which is a good thing, as it can help us and many others along the line in the future. That is all. Thank you.
So hi everyone, I'm Clifford Aragoncillo of Group 11. So this collaborative online international learning between San Pedro College and University of Kebangsaan, Malaysia gave me another venue to learn more things with regards to my chosen program. So in the first day of this workshop about pharmacokinetics, I was able to observe in the different groups on how the students act as a pharmacist on a given case. While on the second part of this workshop, about medication review, I was able to learn also a lot of things during the lecture time, and gladly I was able to apply it during our activity time. So this COIL program gave me an opportunity to interact with other students, especially coming from UKM and also my schoolmates. And this program gave me an unforgettable moment since this is one of a kind, and kudos to the organizers. That's all. Thank you.
During the medication review workshop in partnership with UKM, I have learned the different factors that affect non-adherence to patient in both Philippines and Malaysia. It also gave me a wider perspective on how we can address such situations so that patient could also address to this issue. I think one point that I have learned through this activity is that I am able to know that our different cultures have really an effect on our daily lives that could also affect our attitudes towards our medications. So through this COIL, I am glad that I was able to make some friends, and I hope that we will be able to see each other soon, and hopefully we would be able to also work with each other in the future.
Hello everyone, my name is Azrul from UKM. In this opportunity, I want to describe COIL session as marvelous. I think this is because of the activities involved. I have learned several things that are important to the pharmacy field, especially on how different culture from each countries affect their own health systems. Hence, this is a great approach to me to ensure collaborative programs between countries still can be held during COVID-19 pandemic. So that's all from me. Thank you.